We wanted to determine how CBD would affect fetal development and specifically fetal brain development. And CBD, when consumed by a mother, goes into the bloodstream and then crosses the placenta and accumulates in the fetal brain and other fatty tissues. So we wanted to know how that would affect fetal brain development. In my own pregnancy in 2019 and 20, I experienced nausea for the entirety of that pregnancy. And I had people from friends to strangers suggest that I use cannabis or CBD to treat that nausea for pregnancy. But I found that there was nothing available to know whether or not it was safe and how it would affect my baby's development. With funding from the Institute of Cannabis Research, we were able to conduct the first study of its kind to show that CBD consumption during pregnancy carries risks.
Studying different things that we can consume during pregnancy, whether it's pharmaceuticals or recreational substances, is really important so we can educate patients about what is safe and what is not safe during their pregnancy to their developing baby. Retrospective clinical studies do show that cannabis consumption during pregnancy has kind of a myriad of different effects on the offspring. If CBD was a component of cannabis that's playing any role in those effects. And so it's really important to tease out, because people are now consuming CBD on its own, to know if that could be causative of some of those effects that we're seeing, or if it's another component of cannabis.
We had administered CBD in sunflower oil or sunflower oil alone to pregnant mice for the duration of pregnancy. And we measured all sorts of things like how it affected the number of pups that were born and gestational weight gain and the length of the gestation, and none of those were affected. But it turned out that the offspring, the males, were more sensitive to thermal pain or heat, so they were more sensitive to pain, really, those that were exposed to CBD throughout gestation. And then the female offspring had impaired cognition, or they weren't as good at solving problems. But we didn't find any differences in memory or anxiety in these animals. So there were some things that were affected and some behaviors that were affected. And then we found, in collaboration with Wan-Chan Oh's lab upstairs, that the excitability or the function of the area of the brain that's important for cognition was impaired or reduced in those female offspring when they were exposed to CBD. The receptors that CBD activates are really important for fetal development. And so because we know that CBD gets into the fetal tissues and those receptors are in the fetus, we hypothesized that CBD would affect cognition and pain sensitivity and diabetes traits like glucose tolerance and insulin resistance. Our study revealed that CBD is not the safest option to treat nausea during pregnancy. There are other alternatives that are safer that you can discuss with your obstetrician. We all want to do what's best for our babies and for our own health. There was really nothing out there about CBD. We don't even measure how many people are taking CBD because it wasn't perceived as a risk. So it was really important to determine what it does, to figure out what CBD does for fetal development.